presenter is from the education side of our projects. Pam Christianson is the medical assistant, pharmacy technician, program director at Great Falls College, in Great Falls, of course. She has played an active role in Healthcare Montana, working directly with employers to develop curriculum that meets their workforce needs. So Pam, are you ready? And I'll turn it over to you.
Yep, I'm ready.
Great.
Thank you. I appreciate the opportunity to be here today, and we've had some great experiences working with Montana Healthcare, local clinics in the area, and the Department of Labor and Industry. It's been a strong relationship with our community and helping them serve their needs. It started off by I am the medical assistant program director, and we have established relationship with the clinics where they were doing their clinicals, and that's where I worked with Lori Henderson from the Great Falls Clinic, and her doctors had come to her and asked her if they could hire medical scribers. These are people who would go into the room with the doctor and do the dictating for the doctor while the doctor had a one-on-one conversation with the patient. And so with that working relationship that I had with Lori, she came to us and asked if there was some way that we can introduce a medical scribe training for their clinic. Medical assistants are always having new responsibilities in the clinic, from patient navigator to patient healthcare coach to medical scribers. So this was an opportunity to also introduce it to medical assisting students as well. What's nice about medical scribe is there was two options that we could create training or a program. If we had healthcare workers that were already out in the field, we could create what we call a custom training program to help them sit for the national exam and what information that was on that exam. And then we had a non-healthcare route that we could create, which is a semester program for those students who have never been in the healthcare field, and to introduce them to some of the medical terminology and medical office procedures. And then they would do 200 hours of clinical, where a healthcare worker would only need to do 50 hours. So what I did is I researched the information on what it would be to be a medical scriber, on what it would take, and what kind of exam that this would create. And to do that, I researched how I could become a national certified medical scriber myself, because the best way to teach people how to do this is to be able to have the background myself. So I looked up the American College of Medical Scribe Specialists, and through that information I was able to sit for the national certification exam to be a medical scribe apprentice, and then you get switched over to specialist when you complete your clinical hours of 50 to 200 hours. I intentionally took the test 3 times, with failing the first 2 times, so I could get a good grip of the information that was on the exam and what they were looking for. And then once we created this custom training, we went back to Lori, and the Montana Healthcare created an apprenticeship so that we could all 3 work together and create a training on medical scribe that would help serve their needs in the medical clinic, working with the doctors. And that's it.
Great. Thank you, ma'am. Do you have anything to follow up with that, Kay?
Well, I was just going to say that this is just such a great example of when employers and colleges communicate with each other, how we can really work very quickly. Pam worked very quickly to put together what was needed in the community in the field. And I think this is just a great example that we need to use as a model in the future. You know, that it didn't, although there were healthcare staff that helped with the apprenticeship process, those apprenticeship staff, they won't be totally focused on healthcare, but apprenticeship staff will still be around. So if you employers really are interested in something that you need, please do reach out to the colleges either in your area or anywhere around the state. You know, with all the distance learning that we're doing, it doesn't even have to be a college that you're closely geographically you know, close to, because we can create these programs and offer them anywhere around the state. So one of the things that we found from this grant that was just so really effective was creating these communication processes between the colleges and the employers. So I encourage you all to continue that, even though Healthcare Montana staff may not be around. Carol, did you want to add anything to that?
Just that there's a question in the chat for this. Okay, if everybody could mute, please. So Pam, the question is from Letitia Huber, is the medical assistant program at Great Falls College a distance learning program or on-site?
Well, there's 2 accredited programs in the state of Montana, us and Flathead Community College. And what that means is Flathead and us are the only ones that can have students sit for the Certified Medical Assisting exam through the American Association of Medical Assistants. My program is mostly online, except for 4 classes. That would be the clinical procedures 1 and 2 and the lab procedures 1 and 2, where we do the hands-on skills. They only meet twice a week, but I've had students come from Billings, and we would meet once a week with them and work with their hands-on skills. So we do work with distance students and try to get them with the hands-on skills that they need in order to do their internship. As far as the internship, we can go anywhere in the state of Montana and anywhere in the United States. We don't have to localize the internship or the clinical hours in the Great Falls area or even in Montana.
All right, thank you. Any other questions for Pam? All right, and we will have time at the end of the presentations to circle back with questions. So could you advance, please, Kay?